Hey folks, Mark Scroggins here with another edition of Family Law Talk, and today I've got the privilege of having a buddy of mine, Dr. Stephen Courtney, with us.
Hey Mark, how you doing?
I'm good, man. How are you?
Good. Thanks for having me on Wednesday afternoon.
Well, right? You know, nice that we can do this. It seems like last Wednesday afternoon I spent with you, you were busy working on my neck. So.
Right. Yep. Yes, we've done that a few times.
Yeah, so I've spent. God, it's hard to believe that the first time you worked on me was 17 years ago.
That's a long time. I've been playing up for 26 years, so I see quite a few repeat patients and get to know quite a few people in the area. So I've been doing it for quite a long time here in Plano.
So why don't you kind of explain what your specialty is, the different areas that you do, and the type of situations that would bring someone in to come see you.
Right. And again, I said, Mark, I've been here for 26 years in Plano, and I'm an orthopedic board-certified spine fellowship trained surgeon. So my practice is devoted only to spine only, and primarily in adults. So usually people late 30s, early 40s, 50s, 60s. Those are people who usually come visit me. Yeah.
So I first met you when before you had your own practice. You were part of another practice, and through a buddy of both of ours, right? That was kind enough to say you need to talk to Steve with the problems I was having with my neck.
Yeah. So our buddy, he introduced me to Mark, and you know the good non-compliant patient that Mark was. So I did I think a 2-level neck operation on him, and then him being a divorce attorney, these guys don't stop. So I ran him on later on that afternoon, and there's Mark eating I think he was eating a steak and a mashed potatoes. So I said, "What are you doing?" I said, "He's filing some pleadings," but so he had no problem with his voice or his sore throat after his first operation. Yeah, that was about 17 years ago. It's a long time ago.
Thank God I had a paralegal who was kind of riding herd on me a little bit to keep that stuff from going out. So it was a little crazy. That was back in the day when I actually still smoked, and I was walking outside with my the IV bag. Was walking out, and remember a nurse was trying to tell me that I couldn't do that, and you just like, don't waste your breath, let him go. Walked outside, smoked a cigarette, and came back.
Yeah, the type A personality people, you can always tell them, so you can't tell them anything, but you can sure see them. So I've been doing it for a long time to know who's coming in the front door and how they're usually going to act afterwards. So, but that's a long time ago, 17 years, and life goes by. Mark wears out. This wears out a little bit further, so people wear out, and that's why I've been playing for 26 years now plus.
Well, and anytime I know anybody, obviously, that's got neck or spine issues, obviously the first person I have them call is Steve. You've seen, as a matter of fact, you've seen lawyers and paralegals that work for me.
Oh yes,
I have seen you as well.
I've seen quite a few different types of people. Yeah, so most people have my back hurts, my neck hurts, my leg hurts. Disc pain, some people can't walk very far, and the majority of people have had, of course, non-operative treatment, medications, physical therapy. I'd also do my own injections as well, so I know these patients extremely well. So I do my own injections on certain patients too. So it's a process. Let's take it back up. Here we go.
I know that's something that we messed with first was going, doing the. Doing some of the injections and trying some physical therapy and some different things before we got to the point of cutting.
Right, and that's how it typically runs. But if you don't have that look when you first come to the front door, what's that look? Said you know it when you get it. So when you get that look, most times you may need surgery a little bit sooner than later, because sometimes you wait too long, you can have some permanent nerve damage, and that's just reality. So. And it is a process. So some people need non-operative treatment. Some people need surgery sooner than later. Right. And it's just all across the board. Yeah. So it really is that way.
Well, I know this time we did surgery at Eminent Hospital, which is yours, correct?
Exactly. Right.
And then you also have you've got some of your latest tools and things and prosthetics. Is that even the correct name for all of these?
Well, they're. So there's a lot of different, you do minimally invasive surgery. So minimally invasive, this is the minimally invasive surgery. So when you put it in the patient's hands, which I always do, they're like, wait a minute, what happened to the small incision? But but these are real minimally invasive screws, and so these are the screws that go in patient's back and rods. So this is how you stabilize someone's back. So this is made for the lower back. So I started Eminent Spine, spine company back in 2008, where I actually designed them. Matter of fact, I'm actually get the FDA approval process as well. I've been doing that since 2008. I'm very efficient at it. So I think we have about 8 or 9 FDA letters now, and we sell it all throughout the states. We sell it some international as well. So, but for as a patient goes, it's nice to see, at least you're able to see at least once. And I think this is what Mark has in his neck, this plate, the cervical plate.
Right.
So there are different technologies, different type of metals you use these days, materials. So that's just pure titanium, and these here just are 3D printed titanium. So there's a lot of different metals we're utilizing these days for implants in persons' bodies. Yeah.
It's interesting. I know when you went in and you pulled out that section that had been done 17 years ago, and it had your initials
on
it.
It did. Yeah, yeah, that was a long time ago. Actually, yeah, I told this one company I'd make a plate for them, but in those days, all the plates were all titanium. They're all gray. They're not very fun. But this is all you do. So all my color are usually purple, green, and gold for LSU. So, but you can actually see them. So it's a different color scheme when you do that. But it wears well, so it did well.
Well, I wanted to I want to come back around and talk about some of that in a little bit, but I wanted to talk about some of the different things that you see, and really where I see some of that too in my divorce practice. So one of the things, when people come to me and they're planning on getting a divorce, I mean, you've gotten to the point where you're not getting along anymore. Right. And it is amazing to me, as I saw you talked a little bit about, when someone comes in and has got that look. And when I came back in, you told me that I had that look, but I still, being the kind of pain in the ass that I can be, I wanted to go ahead and, for about a year, I fought it. And so I lived with constant pain for that period of time. And so I see the effect. I saw the effect on it firsthand, and I can see the effect that it can have on a relationship, like on my marriage. But is that something that you see that people are concerned about when they first come and see you? And can you explain a little bit what people go through with that?
Yeah, when you get in the chronic pain, or hell, any type of pain, quite frankly, acute pain.
Right.
But the chronic pain, the people I typically see, you can see the strain on their marriage because pain. It's a very depressing. At least it can lead to a lot of depression. And typically the patients are about mid-40, 50-ish. Sometimes their hormones have gotten out of whack a little bit, and they get more depressed that way. But back pain and neck pain can definitely distress a relationship very quickly, and you can usually see it. I've had several patients, who've gotten divorced from it. I've seen people who I've been knowing for many years, and then they just decide to get a divorce because it's a strain on the relationship. Just on that, depression, it's not a happy situation to be in.
No, hell, the irritability that goes along with it. I mean, some people that are sitting here right now saw me in that, and I'm a little bit A++, to begin with, and so you add the constant pain in, and I was a bit of an asshole.
Yeah, so you have as a spine guy, as a spine surgeon, you have to have a very unique temperament to deal with people because they're irritated because they're irritated for different reasons, not because they're in your office, because they're irritated because they're in pain and they're just irritated for different reasons. But they go hand in hand, and you can always sort of sense and smell them if they're getting irritated for different reasons. And sometimes you got to just calm down, and let them vent a little bit, and that's fine too. So I sort of treat the entire patient. My patients, I know a lot about what they're doing from a personal standpoint, because I show them all these implants too, because I think they need to have an opportunity at least to see what's going on in their body, because a lot of patients, you'd be surprised, they just don't.
Right.
But it causes a lot of pressure, and then they get depressed, they don't like to work out, and it's a snowball effect, and no one likes working out when they're in pain, and it does cause a lot of emotional charge there, if you will.
Sure. Let me ask you this. So when you see somebody that's got a lot of constant pain going on, what kind of suggestions do you make on ways to deal with that?
Right. And then, one of the things, try to make some type of pain journal where you can determine when your pain, where is it Is it during the morning time, evening time? And also the location of the pain. Is it in your neck or your back?
Right.
Get more familiar where your pain exactly at. But if you're having true nerve pain, those patients are drawing, they're having pain radiating down their arms, down into the legs. But weight's a big thing in the United States of America. It's a big thing right now. And weight, it does put a lot of stress on your lower back, not so much on your mid back or on your neck, but definitely your lower back. So weight reduction is hard to do. Everybody likes to eat food. I get it, but it's a major factor in backs. That definitely does that. But weight reduction would be helpful. It's hard to work out when you're in pain, and also certain exercises that patients do, but maybe the wrong ones. As a different a different decade, you may have to modify your workout program because you just have to do something.
I remember you telling me 17 years ago that I needed to stop lifting heavy.
Yep.
And I was not real good at listening.
No, and the smoking thing, you don't look really good when you're going out the hospital with your gown, your behind showing, and you're also having a Winston or Marlboro in your hand smoking. So that was not really a walking person of health there. But I think you got probably a little bit smarter, more educated, and a little more mature. Say the last word lightly, but I don't think you're smoking anymore, which is a major issue in backs and necks.
Yeah, I cut that out 8 years ago. So
yeah, that's good. It's hard to do. So weight's the big thing. Smoking is a massive thing in necks and backs, especially when the outcomes. The diabetics are more prone to have issues and complications too. So those are usually the three big variables that get people into complications, and especially the smoking. I don't care if you're vaping or. It's just a smoke. It affects how the body heals, how the bone heals. It's a major effect on it too.
I think that's all fantastic advice and important for everybody to understand. Because nobody, especially, I notice now I'm 54 now, and so it's not like we don't heal like we did when we were in our 20s.
No, we're not either. So definitely don't. And I tell people I've gotten more sensitive too. I tell people not to get maybe a little bit less puffy,
Right.
I used to say different words when I was a little bit younger, but because I'm right ahead of you. But if you do something, on maybe a routine basis, just something, walking, swimming, or biking, or light weights, nothing heavy, don't strain.
Right.
It helps. Everyone's fighting gravity, everyone's fighting stress, so it does help combat that to a degree because no one's getting younger and we're not getting any prettier either. So that's
well. I'm gonna disagree with you about the not getting any prettier. I think I'm getting prettier every day. So one of the things though that I noticed also I wanted to talk about. We've had a lot going on with the opioid crisis in the U.S. and you hear the horror stories. Seemed like the vast majority of them came out of Florida. Someone writing 1,000 Vicodin a month for someone. I mean, and that's a clear cut deal. But what's your opinion on this? Because I started wondering. Did it go a little, has some of it gotten too far where doctors are scared to prescribe pain medications for people who really need it because they're fearful about, Big Brother coming to get them?
Right, because there are definitely agencies that track what type of medication that you do as a physician, and as well as they should. That's their job.
Right.
But sometimes patients need pain medication to get them out of the acute pain. You don't need to go sell it on Loop 12 down there, but you need to. But sometimes I think they've taken it a little bit too far, and sometimes the insurance companies won't even approve the pain medication.
Right.
So it's a multivariable factor there. But some people who need it, you can usually tell if they need it. Most physicians should be able to see if they're drug seekers, and there are programs out there that do track patients, and they can know exactly what type of medication you're on. So you can't really lie to the doctor if the doctor has the right software. But it was a big process, and I think the government did do a reasonable job of trying to combat it to a degree. But there's some bad actors out there writing too much medication, so they got disciplined with what they deserve. So.
Yeah, it's a hard thing, man. That's a hard thing. It's difficult when you've got to be placed in a situation of trying to help someone, but at the same time, you got to be a little skeptical at the same time. And
there's medication you right, like the right dose of steroids. Steroids, they get a bad reputation, but if you do the right dose and the right duration, they're perfectly fine. Same thing with muscle relaxers; they can help some too. So it's a multi-medicine approach to medication. Yeah.
I think one takeaway, though, is the right combination is something that can really help someone that's dealing with acute pain.
It's vital because a lot of people who see me have already had the Medrol dose pack, the little 6-day pack. It's already pre-printed so the pharmacists and the doctors don't have to go back and forth to see what dose it is. But if you increase the right dose for spine patients, they can see a lot better improvement if you get the right dose of steroids in them. So, but not all the time, but short term is perfectly appropriate.
One other place that I think our practices cross paths is when dealing with Hipaa.
Oh, yes. I know a lot about Hipaa.
So that is something that, it scared lawyers to death, especially the lawyers, divorce lawyers like me that, in child custody matters, we're looking at mental health records and all kinds of things and making sure that you've got all the proper releases signed. And that's something I'm sure y'all have got to deal with.
Right, and that's typically the first page you fill out in a physician's office is HIPAA form. Your information is between you and your physician, and not for everyone else. So,
right.
I think the federal government has done a good job of diversifying that and getting better control on that. Some people do violate it, but the patients, that's their information, not for that physician, not the other people.
Well, and you recently came out of a lawsuit winning a big judgment, and thank God you were finally vindicated after how many years did that crap go on?
That lawsuit went for about 5 years, but it had been going on since like 2004. People stealing my patient's charts and so forth, and just a damage model, but I finally figured out what was going on with them. It's taken me 5 years to get them there. So I think 4 weeks ago, went to the Collin County and got a jury trial in my favor for those people. One physician and one was a defense, one was a malpractice attorney, one was a federal prosecutor attorney, and one was another individual. But they got guilty verdict for about a $10.8 million verdict in my favor because they got exposed, they got caught. And then they're sharing patients' information inappropriately and unlawfully. So the jury in Collin County, in my favor, which I was very relieved to, and helped my reputation because what they try to do is destroy my reputation. It didn't work for them. So,
well, I know that makes the relief that's got to provide for you, and having known you professionally for a long time, it sure made me feel good.
I come from a little different part of the country, but yes, these people were still in over 1,571 patients charged. So it's probably one of the biggest HIPAA violations in the United States of America. I didn't let it go. I kept pursuing it because something was wrong here. It wasn't right. It didn't smell right. And it took me a long time, a lot of money to expose them, and I sure did.
Well, I'm glad that happened. And let me ask, what else is left in that?
Right now we got that verdict about 3 or 4 weeks ago, and now their criminal side is coming because what they've done is it's just criminal charges.
Right.
So the criminal, they won't investigate it until the civil side is over, and it's over. And it's just basic. That's stuff you just don't do.
Right.
They got caught, and they had burner phones they were using. They're communicating with people with burner phones.
Oh my God!
And the federal prosecutor was telling them to destroy evidence, or computers, or laptops, or thumb drives. And one of the other attorneys had this massive list. I think she had it back in 2011. And she's just taking that list and throwing it in the poopy diapers at her daycare because that's what she wanted to do, to destroy evidence. So they're destroying evidence left and right.
Oh my
God! They got caught. So they got caught, all right.
Have any of these folks lost their licenses yet?
One physician, a spine surgeon who started all this, most of it started, he's no longer practicing in Texas, and he's no longer in the state of Texas. He sort of had to leave. So good. I don't think he's practicing anymore anyway.
Wow.
And the other two people, the other attorneys, they're I think one might have quit practicing. One still is for right now. It's a different process. Yeah.
Yeah. Sounds like they might have a little bit more to worry about than just losing their license.
Right. Yeah. That's I do a lot. I do everything compliant. I do things the right way. There are some physicians, like regular people are, they don't do it the right way.
Right.
But if you do it the right way, if you can do it, that's appropriate, and there are people that are out there that do it the right way, and I'm one of them.
So let me ask this, Steve. When should someone come and see you when they're having some neck or back issues?
A lot of people come usually get a big clinic on Tuesday from people doing things on the weekends. But if the pain is more persistent, if it's over 2 or 3 weeks, that'd be a reasonable approach. But a lot of people just come see me to get educated what to do and what not to do. It's probably the most important thing. But if you're having the arm pain, the leg pain, or just having a lot of strength of your hand or your foot, you probably need to need to see someone a little bit sooner.
I remember that's when I saw you the first time. I had drop foot.
Yep, you got it. You got it. And you may sometimes you get the function back, and sometimes you just don't.
Right.
That's permanent nerve damage, and it depends how each nerve root responds to it. So, and it's all about that. It's all about the MRI scan, what type of symptoms you're having.
So on to something that is really important.
Yeah.
What the hell is going on with LSU?
I don't know what they're doing this year. Yeah, they're having a real problem. I'm an avid LSU fan. But yeah, I don't know what they're doing this year. But I went to all the games, 2 years ago, and this year's been a little bit of a crazy season for them. Last year was an unusual season, so the 2019 season was a magical year. So
Right.
I got all type of stuff in my office about LSU and a lot of it, but they need some help, intervention, to say the least. I think they're fixing to get it. Yeah.
Yeah, I mean, you're as much of a nut about LSU as I am about University of Texas. So
I went to LSU Texas game 2 years ago.
Right.
When I was way up there, but that was a fun game for me.
It was good for you. I was there too. I didn't enjoy that quite as much.
Yeah. So I went to that one. Went to LSU Alabama game at Alabama, and actually those fans were actually very nice to us. I mean, my 2 daughters, and I think we might have spent $50 a whole weekend. They were so helpful, and they just bought everything for us. It's sort of unusual. It was really bizarre.
Yeah, that's a nice deal.
It was. So they're working through it. Yep.
Now, supposedly, I'm hearing that Lane Kiffin might be the guy y'all are going after.
Yeah, I hope I won't go on that discussion, but I would say get someone else. His name keeps floating around some. So he might want to keep eating his popcorn at Ole Miss, hopefully. Yep.
But
you never know.
You never know. I know. Texas just went through this, so I am full on drinking the Kool-Aid of Sarkisian. Let's hope that it starts to pan out.
Yeah, I think they're playing better. It's just been a little bit unusual year this year. Yep, it has been.
So, Steve, I want to thank you for joining me here today. And, folks, if you ever have any back issues, trust Steve. He has done wonderful work on my neck twice. I feel like I'm about to be the bionic man with everything that's put together now. But
you're getting closer to it. Yeah.
So, folks, thank you much. Go see Steve Courtney if you have any back issues. Where they can get a hold of you, Steve?
AdvancedSpineCenters.com. Ask anybody in Plano, they probably know me.
There you go. All right. Thank you much, folks. And, tell your friends and come back and see the next episode as well.
You're good. Thank you, Mark, for having me.
Thank you.
Appreciate it.
Thank you.